everybody, Dr. Chris here from Human 2.0, and today I'm going to talk to you a little bit about knee pain. Knee pain is one of the most common complaints I see people for in my practice as an orthopedic surgeon. One of the most common causes of knee pain, or what we call anterior knee pain, is an imbalance in the muscles on the front of the thigh. The muscles on the front of the thigh are known as the quadriceps. Obviously, there are 4 muscles. Those muscles attach onto the proximal patella, or the top of the kneecap, and in order for the kneecap to track straight when you flex and extend your knee, the forces on each side of the kneecap have to be balanced. If there is an imbalance between these forces, then you may run into a problem where you have maltracking of the patella, which will lead to increased pressures behind the kneecap and therefore pain in the front of the knee, or anterior knee pain. The constellation of problems which result in pain in the front of the knee is often called patellofemoral syndrome. Now, it's important to know that not all knee pain is created equal. Yes, there are other areas in which you may have pain in the knee. That may be on the inside of the knee, or the medial aspect, the outside part of the knee, the lateral aspect, or the posterior aspect of the knee. And all of those types of knee pain have different causes. If you are at all concerned about your knee pain, you need to go seek medical attention. So basically, I like to use 2 exercises as the mainstay of treatment for anterior knee pain. And both of these exercises are relatively simple to perform, and they do not require any additional or any specific equipment. Both of these exercises employ isometric muscle contractions, and they are scalable up or down as your skill, strength, and technique allow. Generally, I would try these exercises for a period of 6 to 8 weeks before I would expect to see any changes. So the first exercise that I'm going to demonstrate is the squat hold. I would prescribe this to my patients for a total of 10 minutes per day, usually in increments of at least 1 minute. Not all 10 minutes have to be done at the same time. So I'll demonstrate this exercise for you now. If you want more specific instruction, you can check out my video on how to perform the squat. The link will be down in the description. So remember, up to 10 minutes per day in 1 minute increments throughout the day. And after all, this is a resting position in many cultures. The other exercise that I'm going to show you is also an isometric hold. This exercise is called the shrimp squat hold, and it can be performed in a variety of degrees of knee flexion. So basically, you're balancing on one leg while you're bending your knee. And as your strength and skill level allow, you will increase the degrees of knee flexion for the hold. Now, when we perform this exercise, we are trying to build time in this position. A reasonable initial goal is 30 seconds a time for 3 times throughout the day. You don't need to do all of the repetitions at the same time. You can intersperse them throughout the day as your schedule allows. For more specific information on the shrimp squat hold, you can check out the link to the other video, again, in the description. For both of these exercises, the key point is knee position. You always want to have the knee position over the outside edge of your foot. 2 finger breadths outside and 2 finger breadths in front. That's where your knee should end up. That's 2 great exercises to help with the prevention of, or in some cases, the treatment of anterior knee pain, or patellofemoral syndrome. So I hope that's been helpful. This has been Dr. Chris for Human 2.0, where we build better humans.